First, though, we turn to the closed Canadian-U.S. border. The federal government says it will start to ease travel restrictions very quickly, very gradually. And that process begins next month. Fully vaccinated Canadians and permanent residents flying into Canada will no longer have to quarantine at a hotel. Patty Hajdu is the Minister of Health, and she is in Thunder Bay. And Minister, thank you very much for joining the program. Lots to unpack here, including this plan, which looks set to kick off in early July when fully vaccinated Canadians would no longer need to self-isolate for 14 days. But what is the benchmark to get to that point? This is dependent on case numbers. Or when do we actually get there?
Well, the plan is, barring anything unusual happening, either with our own disease activity or anything globally, we will be proceeding, as you said, in early July with this plan. And it really does build on the report from the panel of experts that have been advising us on how to gradually release measures at the border while also protecting the health and safety of Canadians.
You bring up the expert panel. One of their recommendations a couple of weeks ago was get rid of the quarantine hotels. And their logic, they said, is the disparity between the land and the air borders, the fact that people were just crossing at the land borders or were flying in, paying the fine, and getting out. Why retain the quarantine hotels for the partially vaccinated or non-vaccinated, given the advice that you got from that expert panel?
Well, we've been working in a few different ways, David. First of all, with provinces and territories who want to be reassured that the federal government will take its time with opening the border, do so in a way that protects the gains that we've all made together, and that respects the need to protect provinces, territories, and indeed local regions from outbreak. And secondly, of course, the panel's report was very helpful in informing the Public Health Agency of Canada and Dr. Tam and her team of experts who have suggested that we move slowly and cautiously, again, with the lens of really ensuring that we don't disrupt that progress that we're seeing here in Canada.
Just so I'm clear, though, why is it that you took the advice of the expert panel on reopening, but not the advice to get rid of those quarantine hotels?
Listen, I think that every layer of protection that we've added at the border has allowed to ensure that we are doing everything we can to detect travelers who are positive for COVID-19. And the government authorized hotels played an important role and still do in ensuring that people have a safe place to isolate while they wait for their day one test. As we know, air travelers are often traveling en masse and have further travel to pursue to get to their final destination. But the road, the travel by land is often private and going to private accommodations. We believe this is a cautious and appropriate first step. It will allow fully vaccinated travelers with right of entry to Canada to remove the obligation to stay in a quarantine hotel and also to isolate for 14 days, provided they get that negative day one test.
And walk me through the logic there. Why would fully vaccinated individuals need to take a negative test and home quarantine until they get that negative result?
Well, we know that in very rare cases, there are breakthrough infections of fully vaccinated people. It is rare, but it is possible. And we also know that as we see the virus mutate and change and variants continually arise as a result of that virus changing and mutating, that it's best that we fully understand how vaccination is working for Canadians returning into the country and that we don't take undue risk in terms of fully vaccinated people potentially being infected. Now, again, we'll be monitoring the data that we collect through this process and analyzing it through the lens of how many people are actually infected who are fully vaccinated. And we are prepared to adjust our posture as we learn more about how we manage fully vaccinated people.
How do you prove it? How do you prove you're fully vaccinated at the border?
Well, first of all, the vaccination has to be with one of the 4 Health Canada approved vaccines. And secondly, documentation will be uploaded into the ArriveCan app. This app has been very helpful in streamlining travel during the pandemic, and it will be a tool that will be very useful for Canadians. They'll be able to upload their documents in either French or English, or translated into French or English if their vaccine has been received in a country that doesn't have those options.
We've seen some fake vaccination cards in the United States. Is the Canadian government worried that travelers may present false credentials, false proof that they've got the full vaccination?
Well, first of all, fines will apply if people are presenting false information at the border, as they
If you
have all
find them,
along.
if you catch them.
For sure. Obviously, we expect Canadians to want to protect each other, first of all. And I would say that Canadians, by and large, are doing that. And so, first of all, I know that people want to protect the health of their community. They want to protect the economic recovery of their community. And so, we anticipate that Canadians will follow the rules.
Mm-hmm.
But, in the case of people presenting false documentation, the CBSA will be working very closely with their team, with the digital team, to make sure that the Arrive Can app can detect false documents and will reject them. And in fact, we've got some experience with this, as you know, with pre-departure tests, and we'll build on the knowledge that we've learned in requiring documents such as pre-departure tests to be loaded into the app.
So I want to ask you about children traveling. Let me throw the scenario at you. There's a Canadian couple that has 2 children under the age of 12, and therefore they haven't been able to get a vaccine for those kids yet because they aren't eligible. The vaccine is not yet approved. They have a grandparent in Jamaica and want to go and visit. While the 2 fully vaccinated parents can avoid the quarantine hotel, what about those kids?
Well, first of all, David, we won't be splitting families up. And so the solution will be to ensure that families can stay together and travel together. And again, we'll be talking to provinces and territories about exactly these types of scenarios. But the first response is that we will not separate families who are traveling together. And there may be other situations where people are not able to receive a vaccination. And we're working through all of those details now with our experts and also with the provinces and territories to gauge their comfort level for those exact scenarios.
And just for clarity, I mean, in that kind of a scenario, if you're not going to separate the family, is it not separating them by putting them in a quarantine hotel, even though the parents don't technically need to go there? Or is it extending the provision to the children that they can home quarantine?
Again, I'm not comfortable making a guess in this space. We are working through some of those questions with our officials right now about how to best manage families or groups of people where there are people that are ineligible to be vaccinated for whatever reason, whether it's age or a medical condition, and what can be done in those circumstances to ensure the safety of all the travelers and the community that they're returning to. And we'll have more answers on those very questions in the near future.
So when you talk about the near future, we're about 3 weeks away from when you could potentially be doing this gradual reopening. When can Canadians who need to travel or want to travel expect some clear benchmarks and guidance on things like family travel?
I would say in the very near future, David. I'm reluctant to give you a date because, again, there are ongoing conversations with provinces and territories who may have slightly differing views. And I will say this, it's important that we have the full comfort of the provinces and territories on the plan and that they've had an opportunity to weigh into these exact details. And so we'll come back to Canadians in the very near future with scenarios and with written information that will give them the guidance that they need as they plan their travels as fully vaccinated individuals.
I wonder what you make as health minister about some of the criticism coming from the United States, and it is growing louder and louder. American lawmakers who are frustrated and say that Canada's current measures are logic defying. They want to have clear benchmarks, clear times about when all of this will reopen, make it easier, including for Americans to travel north. When you hear that level of criticism coming from our largest trading partner, how do you respond?
Well, hopefully I can reassure Canadians that we continue to be in very close conversations with our American counterparts. I met with Secretary Becerra last week. He's the health secretary in the United States. We agreed that the health and safety of Canadians and Americans has to be paramount and our first priority. And we also agreed that it would be beneficial to both countries to come up with a shared health protocol to ease travel. Now, having said that, David, I will say this. It's important that to Canadians that above all, we protect the recovery of Canada. we are seeing some really great news, declining numbers of people getting sick across the country, a reduced pressure on our healthcare system, a slow and cautious reopening of small businesses and medium-sized businesses, and a resumption of normal life. And Canadians don't want that threatened, and that's why we're taking it so carefully.
Minister Hajdu, thank you for your time this afternoon. We do appreciate it.
Thank you very much, David.
Hi, I'm Vashi Capellos, host of Power in Politics. See more of our show by subscribing to the CBC News channel or click the link for another video.